Hi there, my name's Dr. Sonal, and these are my opinions only, not of the institution I work for, not related to the medical community of which I'm a part of, but just my opinions. Thank you. Hello there. So you've talked with your physician, you've been diagnosed with COVID, either presumptively positive, where they're assuming that you haven't and having you self-isolate at home, or that you've actually had a positive test and you've been told to go home and isolate. People who may have gone in for testing are going to be people who have had an organ transplant, who are pregnant, who are healthcare workers, nursing home workers, immunocompromised in some way. They may have lung disease. So if you have something that puts you at significantly higher risk, then they may have you go ahead and do the testing and not just self-quarantine at home. We know that cardiovascular disease, diabetes, hypertension, lung disease, chronic kidney disease, having cancer diagnosis, immunocompromised with rheumatoid arthritis, inflammatory bowel disease, Crohn's, ulcerative colitis types of things like that. Or even having a body mass index over 40, so being morbidly obese can be risk factors for more severe disease. The way that we go ahead and have you do this at home, technically what you should do is, if you can, be in a separate room and a separate bathroom than everyone else in your family. And that way, all the high-touch frequent surfaces that you're touching, you will have limited the exposure to anyone else in your household by you being the only person touching in those places. And so if you can do that, that would be ideal. So no one else is touching that light switch, no one else is touching that sink tap, no one else is touching the toilet flush, only you are. Ideally, that person should stay in that room and be quarantined only there and use disposable dishes so that no one else is having to touch those dishes or other things like that, because that can serve as a fomite or an area of spread where some inanimate object is touched, shared with another person, and they also touch that object, and then they can touch their eyes or nose or mouth and potentially spread it to themselves. It's not so much that just touching the plate would give you germs, but you would have to touch the plate and then touch your face to spread those germs. So if people are quarantining at home, the recommendations are right now that the person who's diagnosed as COVID positive or presumptively positive should be home. The CDC recommendations are for 72 hours after symptoms resolve and then another 7 days. I don't completely agree with this because germs have been shown to be virus actively spreading and shedding for 8 to 37 days after someone has a positive test. And so to me, that's concerning for exposure longer than the 72 hours plus 7-day window that we're giving right now. So personally, in my family, if anyone is exposed, we will be doing for 14 days after symptoms resolve, that they will be at home on a self-quarantine. Everyone else that lives in that family who is a household contact of that family should also stay home for 14 days. They will not be hopefully using the same room and the same bathroom as the positive or presumptive positive person, but they will be in the rest of the home. They should not go to the grocery store. They should not be going outside. They should not be checking the mail. They should not be doing other things that can put other people at risk, because those 14 days are that one incubation period to see if they develop symptoms. After 14 days, if the other potential household contacts that could have gotten exposed have not developed any symptoms, then they can go outside and go about their business after that. Every one of us should be wearing a mask when we go out, regardless, because we can protect other people from the germs that we may be spreading and shedding. But when you're on quarantine or when you're in the home of a quarantined person, you should not go outside for those 14 days. The person who's been diagnosed as positive or presumptively positive, I personally would recommend to be on the side of caution, even more aggressive than the CDC recommendations, which is symptoms improve and then 14 days after no symptoms to stay home, since we know that that person could be spreading and shedding for up to 37 days total. The other thing that I do want to mention is that if you are diagnosed as positive, it may be better to take Tylenol instead of ibuprofen. And if you're on steroids chronically for some other reason or for a short-term reason, then to make sure that you talk to your doctor, call your MD, because it may not be a good choice to continue those steroids at that time, because there may be some worse outcomes in COVID-positive patients if they're on steroids and if they take ibuprofen. Some of these things are iffy, not completely with British Medical Journal ibuprofen article and others, but I'm just mentioning and throwing them out there just so you think about it. But the most important thing, regardless of whether you think you have symptoms, whether you think you need testing, whether you think you're positive, whatever the question is, call your physician, call your MD. Thank you.